Why community? So we can keep patients independent in their own homes as long as possible, working with families and the larger care teams.
It's a privilege to be invited into patients' homes to see how and where they live, and then to be able to remain independent, especially with their breathing conditions, to remain at home.
There's just something really special about nursing people in their own homes. It's just completely different. As a student, I'm taught all about person-centred care, holistic care, and to me that's what the community provide.
Why community? Because I get to know my patients properly.
Because it's an absolute honour and a privilege to be welcomed into the homes of our community patients to meet their needs for nursing and therapy.
So I love working in the community and treating people and patients in their own homes, and I think that's a lovely privileged position to do so.
The most rewarding part of working in the community for me is to enable patients to die at home, where they can be surrounded by their loved ones, their friends, their family and their pets, and we will visit them every day to ensure that they can die in comfort and to meet their dying wishes.
Community nursing runs in the family to a degree. My mother was a district nurse. My eldest sister doesn't work in community but is a nurse also, so nursing's kind of in the family. I worked in community previously as a chiropodist, so I'm used to working on my own. I like the autonomy. I think it's good to be challenged. You are much more challenged in community. You have to think on your feet. You have to rely on your learning, and you have to always be up to date because things are changing all the time. I think we do get to see people much more clearly in their homes. They are much more open to us as patients than they are in the hospital. In the hospital they tend to be very much a patient, and in the community they're very much more a person. So we are able to nurse them much more holistically.
Why community? It's probably the best role for me as a nurse. I get to really know my patients and their families, and we get to be really hands-on nursing.
I've worked in the community for 11 years now, and the team is always evolving, always changing, and there's never a dull moment, and at the centre of it all is our patients, and that's why I'm here, so that I can give the best care to the patients in the community.
I feel that it's really important to allow people to decide what they want for themselves in their own home and choose the care that is important for them and right for them.
I like the variety. We do something different every day. Rather than being a specialist nurse, concentrating on one thing, we do lots of different things. So no one day is the same. It's always something different.
Community nurses are highly skilled nurses, multi-skilled. It's varied from sore toes to end-of-life care.
Within the community, we work autonomously to be able to address the holistic needs of our patients. These patients have a variety of needs, being social, health and environmental.
I got into community nursing because I always wanted to offer holistic care. My first ever nursing placement, student nursing placement, was in a very small village, and the community nurses and district nurses blew me away by the care they were able to offer and the holicism that was invited into each and every individual patient's home, as opposed to a hospital-based care where you only see a condition or a disease. Community nursing, you see a patient, their family, the entire package, and you're able to nurse accordingly.
Community nursing is my favourite sort of nursing because, unlike the hospital, when you walk into somebody's home you can see everything about them almost instantaneously. You can see their family, you can see the jobs that they've had, you can see their passions and interests. You can treat somebody holistically in their own home as well, without distraction from everything that's going on around you. And also, people are much more comfortable in their own homes. People are less likely to catch viruses from other people in their own homes, and they're likely to have the people that care about them most around them at the same time, helping to make decisions too.